He'll be speaking on a comparative trial, topical interferon alpha 2b versus low-dose tacrolimus for vernal keratoconjunctivitis.
Good morning everyone. I'm going to present today my thesis topic, a comparative evaluation of efficacy with topical tacrolimus and topical interferon alpha 2b in treatment of vernal keratoconjunctivitis. My guides were Dr. Taskin Khan ma'am and Dr. V.S. Gupta sir. VKC is seasonally recurrent conjunctival inflammation presenting with just irritating allergic eye disease to vision threatening condition, found twice as common in the young boys than the girls. It generally presents with the symptoms like eye itching, foreign body sensation, burning sensation, and signs like Tranter spots, limbal hypertrophy of papillae, superficial keratitis. The pathogenesis can be summarized in the following flow charts, where we can see the various mechanism by which the allergy was stimulated. So conventionally, we have been targeting this flow chart with steroids to the antigen presenting cells, with the mast cell stabilizers or the antihistaminics. The newer thing we have got is the immunomodulators, that are the interferon alpha 2b and tacrolimus, which acts on T helper cell 2 and the IgE. So we decided to study the efficacy and the side effect profile of interferon alpha 2b with topical tacrolimus and the treatment of vernal keratoconjunctivitis. The patients with VKC were selected. They were explained the nature of the study and obtain an informed consent with the participant and randomly allocated into two groups. The patient were assessed at 2 weeks, 1 month, 2 months and 6 months based on the clinical scoring system given by the Blake et al., where the total subjective symptom score were graded from 0 to 3 and the total subjective sign score was graded from 0 to +3 in following manner. We found that 80 patients of VKC were randomized into two groups of 40 each. The average age was between 7 to 11 years and 3:1 male-female ratio was seen. The total subjective symptom score with group A was seen at the baseline of 6.87, which gradually improved over the weeks and was found significant at the end of the 4 weeks, which was highly significant at the end of the 8 weeks with 0.61. Similarly, in the interferon group, we found that it was significant at the end of the 4 weeks, and at the end of the 8 week, it was again highly significant. Also, the side effect like burning sensation was seen in few patients, but it did not require any active intervention. No side effects were seen with the interferon alpha. Also, the subjective sign score was showed an significant improvement at the end of the 4 weeks, and at the end of the 8 weeks, it showed a highly significant change. Similarly, in the interferon, also it was showed a significant at 4 weeks and highly significant at the end of the 8 weeks. The graph also shows that there was a progression improvement in the symptoms and the signs scores. Even after stopping the drug at the 6 weeks, it continued to improve till the 8 week, though it showed a remission at the end of the 6 months. Treatment of VKC is a challenge. We have the conventional treatment like mast cell stabilizers, antihistaminic corticosteroids, but the immunomodulators are the newer one. However, none of these agents abolish all of the signs and symptoms or side effect free. The tacrolimus and interferon was used in the study keeping in the mind the recurrence rate and the side effect profile of the conventional treatment. Previously, multiple studies has been carried out, but those all have been selecting the patient with refractive cases or the non-responders. Here we tried to break this stereotype and started the immunomodulator as the first line drug. We concluded that both tacrolimus both the tacrolimus with 0.03% was significant improvement in TOS and TSS at the end of the 6 weeks, but it again recurred at the 6 months. Interferon alpha 2b showed a statistically better improvement and better tolerability, concluding that both tacrolimus and interferon are safe and effective, but a long-term show remission at the long-term follow-up. Limitation of our study was that there should be a systemic tapering of the drugs and longer follow-up need to be taken. Thank you.
Asking the clinical significance.
The interferon showed better results than the tacrolimus, not in wise the improvement in the sign and symptom, but the side effect profile was better with interferon. Tacrolimus has always been with a burning sensation problem with the patients, which interferon didn't show.
Burning side effect, what is the difference between the steroids and these things?
Steroids generally come with the glaucoma increase.
No, sorry. Budding the side effects.
Sorry. Cost-wise, the tacrolimus comes at 328 rupees, and interferon, the injection which we used to do is 541 rupees, which used to give a 20 days.
No, my question
sample.
is, what is the efficacy between the steroids and
Regarding the
tacrolimus
efficacy,
and
what is the
the
difference
interferon
between
two?
that?
Currently, in my study, we hadn't compared it with steroid, but I am
Okay.
undergoing with that process.
Okay, then.
Yeah.
Cost-wise, is there a major difference?
Cost-wise, if we see that steroids are really cheaper than this, but they come with the side effect as well as the recurrence thing. And if you go for interferon, it comes at 541 rupees, 20 days drop you can prepare with that thing. So if it prevents the recurrence, that is the main target the patient would like.
But I think you showed in your graph that at 6 months there was a
Yes,
recurrence.
there was a remission in that, but it was significantly below the baseline. It was
But,
still,
but we are not comparing with steroids, so we don't know.
yeah, that's
Vis-a-vis what happens with steroids, we can't comment.
yes, we need to take that
And
comparison.
have you published this?
It is under process, ma'am, in cornea.
What was the original hypothesis?
To compare between the tacrolimus, effectiveness of tacrolimus and interferon, effectiveness and side effect profile of the both, whether one of them is better.
Okay.
Thank you.
Thank you, ma'am.
Thank you, Dr.